Hey guys, welcome back to the channel. I'm Dr. Ella Reed, Urologist and Pelvic Health Specialist, and today's video is a really special one because we're talking about something that most couples overlook when trying to get pregnant: male fertility. And to make this even better, I'm joined by a very special guest, Dr. Danielle Jones, also known as Mama Dr. Jones, a board-certified OB/GYN educator and someone who has done an incredible job fighting medical misinformation online. Honestly, she's one of the reasons I started this channel, to bring real, science-based education directly to you. Intro to Collab. Dr. Jones recently made a fantastic video on optimizing female fertility, and today we're completing that conversation by focusing on the male side of fertility. Because here's the truth most people don't talk about. Fertility is not just a woman's responsibility. What is infertility? Let's start with the basics. Infertility is defined as the inability to conceive after 12 months of regular, unprotected intercourse. And this affects about 8 to 15% of couples worldwide. Now here's the part that surprises a lot of people. About 20% of infertility cases are entirely due to male factors. And in 50% of cases, men contribute in some way. So yes, men are involved in up to half of all infertility cases. Dr. Jones Insight. And Dr. Jones actually brought up something really important. Most women come in for evaluation first, while their partner hasn't even been checked. That's a problem. Male fertility testing. Let me make this very clear. Getting evaluated as a man is simple. Medical history, physical exam, semen analysis. That's it. No pain, no complicated procedures. But it can give us critical answers. How often should you have sex to get pregnant? Big myth. You need to have sex every single day during ovulation. That's not true. Science shows optimal sperm quality happens after 2 to 3 days of abstinence. So what do I recommend? Every other day during the fertile window. Keep it natural and stress-free, because stress itself can hurt fertility. Understanding sperm health. For pregnancy to happen, sperm need good count, proper shape, morphology, strong movement, motility. They also need to survive a very challenging journey through the uterus, into the fallopian tubes, to meet the egg. And sperm are extremely sensitive to damage, especially something called oxidative stress, diet, and male fertility. Let's talk about what you can control. Studies show diets high in processed meat and dairy, worse sperm quality. Diets rich in fruits and vegetables, better sperm health. Men who eat 5+ servings of fruits and vegetables daily are significantly more likely to have normal sperm parameters. Omega-3, fatty acids, foods like fish walnuts, flax seeds, linked to improved sperm quality. Is soy bad for men? This is a controversial one. Soy contains phytoestrogens, compounds that mimic estrogen. Some studies say high soy intake may affect sperm. Others say no effect at all. And importantly, no study shows impact on actual pregnancy outcomes. My recommendation: moderation. Supplements for male fertility. There's a lot of hype here. Some studies suggest benefits from coenzyme Q10, L-carnitine, vitamin E multivitamins. But a large randomized trial showed no significant difference between supplements and placebo. So what does that mean? Supplements are not magic, but reasonable use is generally safe. Cell phones and fertility. This one surprises people. Some research shows men who carry phones in their front pocket may have lower sperm motility. So simple tip: keep your phone away from your groin area, heat and sperm damage. This is huge. Sperm production requires a temperature 3°C lower than body temperature. Even a vertigrest increase can reduce sperm count by up to 40%. Avoid laptops on lap, hot tubs, saunas, tight heat exposure, boxers vs briefs. Good news: it doesn't matter. No significant difference in sperm quality. Wear what's comfortable. Exercise and fertility. Moderate exercise improves sperm quality. Excessive intense exercise can reduce fertility. What about cycling? Mixed data. Some studies, possible impact. Others, no effect. Bottom line, cycling is fine in moderation. Alcohol and drugs. Heavy alcohol use lowers testosterone, shrinks testicles, damages sperm, risk increases with quantity. Smoking, even light smoking, reduces sperm quality. But good news, effects are reversible after quitting marijuana using more than once per week. Linked to past 50% reduction in sperm count, stress and fertility, chronic stress. Impacts hormones, reduces sperm quality, so improving mental health, improves fertility, improves overall life quality. Testosterone warning, very important. This is one of the biggest mistakes I see. Taking testosterone, Mars can make you infertile. Why? Because it shuts down your body's natural sperm production. Effects: low sperm count. Possible long-term infertility recovery may take months or longer. Real clinical insight. Dr. Jones mentioned something I see all the time. A couple struggling, everything seems normal. Then we find out the male partner is on testosterone. That's often the missing piece. Final takeaways. If you're trying to conceive, both partners need evaluation. Lifestyle matters more than you think. Small changes can make a big difference. The big message: fertility is a team effort, and ignoring male health is one of the biggest reasons couples struggle longer than they need to. Outrow Dr. Jones, thank you so much for joining us and for the incredible work you do in educating people around the world. And to all of you watching, if you haven't seen her video on optimizing female fertility, go check it out. It's fantastic. If you found this helpful, comment your questions, subscribe for weekly science-based health content, and as always, take care of yourself because you're worth it.